Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Since I have just had an experience of taking care of my husband when he was having very serious health issues, I can appreciate what a medical supply store is. And even as a gerontologist, I've always known that if you get the right equipment, you can not only live a longer life, you can live a more comfortable life. And that's why I'm so happy that the owner of the Boca Medical Supply is here, and her name is ELAINE English. And we welcome you to our show, ELAINE.
Thank you so much, Anita, for having me.
When I was in your store the other day, I saw how attentive you were with people. And this one man he needed something, and you were telling him, well, why don't you try this? And you really had him interested. And that's very important because people feel a little strange about what their problem is. And a lot of people in these kinds of stores don't really know the products, but you surely did.
That's our forte at our store. We're all well-trained. We're licensed fitters. We have a great background, great service connection with our customers, and we feel very proud and honored to help each and every one of them. It's been around for over 50 years, and my husband and I own the company, and we've been, fortunate to be able to service our community and do a lot of things that other competitors may not be able to provide.
And I can see where you feel very happy when someone comes in and you actually can make them walk out being safer, having the right equipment, and having a smile on their face.
Sure. You know what? It's an unfortunate situation if you have an ailment or discomfort or you're going through an unfortunate situation. So that's where we, take time with each of our customers to actually educate, train, and really develop a relationship with them so that if they need something quickly or home service delivery, or if they need more products that might be more beneficial to them, then we'll be able to really service them in the proper way.
And I can see where baby boomers, even 30 and 40-year-olds, would find a lot of things there. The first thing that it comes to my mind, because I've had some physicians that deal with, veins and what's happening with blood pressure, and you have a great supply of surgical stockings.
Yes, actually this Wednesday, March 15th, we're hosting a Healthy Leg Day with one of the leading manufacturers of compression stockings, Juzo, and they actually are presenting there doing a vein screening. And so we've offered them to come into our store from 10 to 2 next Wednesday, March 15th, to actually do some education as well as the screening to help people along with maybe some problems they're having, some pain in their legs or some discomfort in their feet. As we age, our veins become weaker, and so it's really important to have good circulation to prevent further deficits and actually feel healthy when you wake up in the morning to the time you go to bed.
Right, and as I said, it's not just for the elder crowd.
No.
Because if you're on an airplane, you're going to be on an airplane for a long time, or if you do a lot of standing, or even if you do a lot of sitting. And nowadays, I saw all the different colors. I mean, this isn't something to hide anymore, is it?
No, not at all. It's from, genetics, it's pregnancy, it's long standing on your legs, it's circulatory problems, just a group of different ailments that really add to the discomfort of the leg pain. And so, we offer a variety of all major leading manufacturers of compression stockings. We do custom garments from head to toe. We also work with lymphedema patients that's another comorbidity that might be existing, and we really offer it to each and every patient that comes in or customer that comes in and really actually educate them.
Yeah, lymphedema is very serious. I know when people have had mastectomies and they've had problems, and when you see someone with a big swollen arm, they should actually be getting the massage, and there is something like that. But then wearing that sleeve on their arm is very good, isn't it?
Yes, I'm actually a physical therapist assistant who is trained in lymphedema therapy, and actually it's very important for therapists to partner with patients just to give them the education. prior to maybe having some type of compromise with the lymphatic system. And if that's, something someone is going through now, we offer a variety of different products for them. But yes, the massage, it's actually a stretching of the skin, gentle stretching of the skin and movement of the lymphatic system to help remove it and manage it.
And the other very, very important thing, and I always get upset when I go into a pharmacy and I see they sell walkers and canes, and one cane is not a size that fits all. And people should understand that you need to be trained to understand what the proper walker, the proper cane is, because you could be with a cane that's too large, too small, and you're bending over. I mean, don't you think that there's a real misnomer on all that?
Yes, as a therapist, I actually agree. It's very important that you are properly measured and fit with each piece of equipment and that you're trained in how to use it. And so if that's educated to the actual customer, that way they properly use it.
Right, and so people are very casual about buying something. And please don't, just because someone left one in your apartment from the last time, that may not be the right one for you. I want to talk about walkers, because years ago, a walker was a walker. And today, it's not. It's almost like a little car. The person gets to, well, you describe one of the very best walkers and all the wonderful things on that walker.
So depending on the patient or the customer's ability, we have to look at that, focus on that first. And so we always rule out, why wouldn't we use a cane? Why wouldn't we use a basic walker? Why we need a walker with wheels, something with a back, something with adjustable handles. And we offer all of that. But safety is always our concern. So they have different types of walkers, maybe a tripod walker that, a lot of customers might say that would be the most appropriate, and it really isn't because it's very lightweight. So depending, we have heavier ones. We also have walkers with seats, ones that fold differently, one that you can travel with, a basic walker with wheels, without. Depending on the diagnosis and what your ability is, that's how we would look at. Unless you have a prescription from your physician, then we would identify that and honor and educate the patient on that.
Well, my guest is Elaine English, and I'm so glad that you've come in, Elaine, because it's very hard to describe what would be in a medical supply house. Those are words that could probably be a little bit offsetting to people. Why do I want to go in there with all those products, right? But the way that you have it laid out, the way it is very pleasant, and you have, I'd hate to take inventory at your supply house. It must take a week because you have so many things, little things, big things. Let me just give some information, though, because you'll want to go over there. The one that I actually met Elaine at was the one on Palmetto Park Rd, 1307. And I will give you a phone number. Remember, this is Pencil Talk Radio. Take a phone number, and if this one isn't closest to you, I'll tell you about some of the others, but they'll help you. They'll give you directions. The one on Palmetto Park Road, right by I-95, is 561-368-7430. 368-7430. Now, you can also get on their website, and the website is, and I'm looking for that. Do I have a website? Yes, I do. The website here is easy, BocaMedicalSupply.com. BocaMedicalSupply.com. Okay. Yeah, I see it's right here, too, and I didn't get it. So what we want to do, though, is tell you that there are other locations, whatever's convenient. There are 3 of them. One is on Glades Road, and it's called the Sandler Medical Plaza. The other one is Boca Lyons Plaza. Now, I'm not going to give you all the information because it'll confuse you. I'd like to just give you one phone number. You can call that number, and then they'll help you. Now, the other thing you should know is their convenience store hours, Monday through Friday from 9 to 5:30, Saturday from 10 to 1. So if you can't get there yourself, maybe you'll find someone those hours will be fine for you. Now, the other also, because we're going to talk about mastectomy and things that are very private, you can shop securely and discreetly, and the reason is because you have like a room that's set aside for that, which is really very nice.
It's important. We follow a lot of guidelines that we've been, governed that we have to follow. And so, unfortunately, what we do is we have private and very personal fitting rooms. We offer that for patients who, if you're a man, you need a truss. If you have hernias, we do hernia belts. We do mastectomy products. We do everything for health and wellness. That's what our store is about, the health and wellness for your health. And
your husband's very involved, as you said. Of course, he's a co-owner. And I saw him working as hard as you were working there that day. He had somebody there looking at, I forget what they were looking at, but that's very nice that both of you do this together and you have the same passion to help people.
We have been. We've been in the healthcare business for over 30 years, and we're very fortunate to be in our community, serving our customers in our community. Doctors call. We have physician supplies. We have retail, wholesale supplies, and we offer a wide variety of different products to each and every one of them. And it's very unique in the atmosphere that you go into each of our stores, but all of our employees are very well trained, very educated, and really can provide a nice service to each and every customer.
And so tell us again when you're going to have that special
event. We're having a health leg day Wednesday, March 15th from 10 to 2 in a location at 1307 Palmetto Park Rd in Boca Raton. It's just east of 95, and it's very easy to get to. Palmetto Park Square is the name of the plaza.
And tell us what's going to happen.
So that day we have a representative from Juzo, which is a leading manufacturer of compression therapy, come in, and he will be hosting the event for the vein screening, and they'll come in. It's a quick little test, less than 5 minutes, and you'll get a little results paper, and that will actually identify how well your circulation is, and you can go to your physician, or if you need a vascular doctor, you can take it to them, but they will give you results and actually identify how well and how efficient your circulatory system is.
Yeah, it's really great to have so many products, but why don't you tell us, kind of give us a walkthrough of the various kinds of products. I know you have, of course, the beautiful chairs, the relaxation chairs, but why don't you kind of tell people what's there?
Sure. Since our store is a health and wellness store, we offer a variety of different products. We start with bathroom safety, which offer different types of equipment you may need in your shower. We offer grab bars and installation for showers. We offer commodes, and we offer different types of shower heads for your shower stall, bathtub safety, and then you can walk through the store, and the next section may be respiratory. We offer CPAP equipment for sleep apnea patients. We offer oxygen. We offer skin and wound care, wonderful organic natural skincare line that actually helps regenerate your skin from the cellular level. We have incontinence supplies, and we deliver that discreetly to your home. You can call in. We can do that on a monthly and regular format. We also do wheelchairs, seating and positioning, chair cushions. We offer exercise equipment, different type of strengthening devices that we have. We offer compression therapy, orthotics for your feet. We do custom orthotics. We also do diabetic footwear. We have bracing supports. We also have abdominal supports, different types of trusses. We offer a variety of pillows for sleep patients if you're having some difficulty with sleeping. We offer compression therapy, like I said. We offer a full line of women's mastectomy supplies, from prosthetics to bras. And we also offer maternity supplies from new moms, from different types of breast pumps to abdominal supports, nursing bras. We have some wonderful headwear for coverings for your head. We have wonderful hats, wigs. We fit for each and every one of them.
You have wigs?
We certainly do.
So I need to pay you a visit on my off days that my hair's not doing well. I've been threatening to get a wig so I can just drop it on.
Wonderful. We do synthetic and human hair. Sure.
Good.
Yes,
and
we
are you
do.
The one that does that?
I do. Yes, I do.
Well, maybe I'm going to come over there.
There you go.
I've been thinking a lot about that. So, well, that's quite a display. I mean, you have that all in your head. And so you buy all these products, and so you have to know what's out there.
We do, and we attend different types of trade shows. We belong to a lot of buying groups that are leaders in the industry. Our industry has changed a lot with Medicare, Medicaid, and we accept both of them. Certain equipment cannot be covered that maybe some of our customers think should be, but unfortunately, we don't really make the rules that we follow them. So, we take other types of insurance, private also, and so you just have to make a visit and we can, explain what we do.
It must take, though, a lot of time because a lot of people who come in there, they're really very innocent. They don't really know, and they're just told, well, we want you to get this, or they don't even know if they need something. So they probably walk in and say to you, well, I'm having this problem with my arm, and then you have to pretty much figure out what's going on.
We do, but we always recommend them to follow up with their physician first because they're the ones to diagnose them. Doctors are very happy about that we do refer them to the physician before we make any type of suggestion, because if it's a fracture or more serious injury, the doctor has to really follow that patient. But then we get to see the patient after that, and we do recommend if they have just a small ailment, maybe just a sprain, or if they have different types of pain. We have wonderful topical ointments that is all natural that can help with pain. We have back braces. We also help with pediatrics. We take a lot of children's insurances, and we can actually help them along with different types of equipment the doctors have ordered.
It's interesting you should mention that because I have a friend whose young child, has a helmet.
Cranial helmet, sure. Yes, they do.
I couldn't believe what she was telling me.
Yeah, so different reasons for that, and it's depending on what the diagnosis is and what the doctor really would recommend. Yes, the cranial helmets are very prominent for different reasons.
So this isn't just, you see, for the older crowd.
Oh, no. I have some customers that wear cranial helmets because of the falling aspect of their life. They might not be safe walking, or they might just need something just to protect their head more than just a bike helmet. But then children, if they're born with different diagnosis or ailments, they may need that also.
And now they've been different sizes, and now that she's taken it off.
Yes,
so it really works.
That's right. They progress. Now, yes, and they do need them for a lot of different reasons, correct.
So you have really been educated, haven't you? I mean,
I have.
Do you attend educational seminars?
Of course I do, yes. I'm wound care certified. I have my therapy license, lymphedema license, and mastectomy and orthotic license in the state of Florida and nationally also.
You have been one busy lady. And so you said you've been in the business for a long time. What really have you seen as changes? What stands out the most of what used to be and what it is today in these products? Right.
So you know what? They've developed a lot. They've come up with some ingenious ideas. They've become more stylish. They've been very good to understand the individual's needs, and they've really focused on that. So from anything from a breast pump to a walker to a wonderful lift chair that elevates, stands, gets you into a zero gravity position with a pillow adjustment to really adjust your neck and your back. It's wonderful. So all the equipment that's out there, they are making strides. Is it costly? Some might be more expensive than others, but it meets the need. And I always say we save for a rainy day, and sometimes it's pouring. So we actually sort of focus on that just to explain, because sometimes, it's very hard to pay for something that might, you might not want to, but, you have the option to do a lot of different shopping, but we're always there to meet your needs.
I never heard that before. Some days it's, maybe it's just sprinkling, but then all of a sudden it's pouring, right? And then
correct.
You have to write the check. Now, Medicare, I'm sure they all come in and ask, does Medicare pay for this, right?
Correct. Medicare is wonderful, and it's always been wonderful, but maybe somebody has thought that Medicare should pay for something that now, unfortunately, is not covered. And, we have to embrace what we have. We really do need to embrace what we have. And Medicare is a wonderful plan that offers a lot. But unfortunately, some of the things that once were are no longer. And right now, there are certain providers that actually can get items covered. But at a lower rate, and you might want something that you want, and unfortunately it's not covered. You always have to remember that Medicare pays for medical equipment within your home to make you more safe and getting through your daily living, daily activities of daily living, but it's not meant to be used outside, it's meant to be within your walls. So understand that anything in the bathroom is not covered. It's meant really within the four walls. So if you need a commode, it means it's a bedside commode. If you need a walker, you can have a walker. That means you're ambulating. Anything in the shower or in the bathroom, it's not a covered item, and a standard walker would be sufficient. It's just what's based on medical necessity is what Medicare is willing to pay.
That's right. Because there's only so much money in it that has to take care of what everybody really has to have. I mean, because people could go out and do things. Now, what about people who, they're caregivers and they're coming in because they have to take care of certain people. So I'm sure you're dealing with caregivers who don't even know what they're supposed to be doing about this, about the person who they're serving. And so you probably have to delve into the life of the person that they're taking care of.
Correct. We always address what the needs are of their patients. Caregivers are really wonderful individuals. They deserve a wonderful accolades. And unfortunately, their patients sometimes can be more difficult, and they're trying to meet the needs of them. And they need maybe just a little education, and we can provide that for them, whether it be skin care, whether it be wound care, incontinence supplies. There's a lot of different options out there, and we always take time to talk to them and to really educate them on that.
Recently, I had reason to see a Hoya lift.
Uh-huh.
And I had never seen that. I mean, sure. And I'm sure that maybe they don't buy it from you. Maybe they lease something like that. Do you have anybody at home using that?
Oh, a lot. A lot of our customers have that.
Why don't you explain what that is?
So, yes. So exactly. So a Hoyer lift is actually a piece of equipment that actually has a sling that can transition the patient from a bed to a chair, from a bed to a commode. And it's either electronic or a manual to actually lift the patient from the surface to another surface. So the patient has to be pretty weak, maybe incapacitated, but it actually helps the caregiver get the patient cleaned, get them moved, get them in a different position, and really helps them care for that patient.
Right, because imagine years ago when they didn't have that, you had to have people that were breaking their backs. It was very hard for a caregiver to deal with that.
Yes. Same with hospital beds. There's different surfaces. Hospital beds are, come from different manufacturers that offer a lot of variety. And what happens is, positioning the patient. You don't want the patient in the same position because you don't want them developing sores. So there's different surfaces, gel, air, foam that can actually help that patient. And you want to get the legs elevated and get them in a different position, turn them sideways, get them really comfortable, but not in the same position too long so that they don't really develop wounds.
Big subject, isn't this? This is not casual. It's not like just having a store like a 5 and 10 cent store, right? You come in and you just walk out with something.
No.
It's a lot of considerations. And like someone comes in, they say, I think I need a hospital bed. So then it starts, right?
It does start. And you know what? You just have to address what's the needs of the patient and the caregiver, and making sure that you get the proper piece of equipment, because sometimes they don't need what they say they need, and we don't want them to have that if it's not necessary. Let's transition them slowly to the proper equipment and get them into a more comfortable position in some way.
And I'm curious about something. There are people that have walkers and then they get better. What can they do with those walkers? Do they donate them, or can they bring them back to you, and can you donate them to a place, or what happens?
So if it's gone through an insurance, you always want to hold on to your equipment, because usually it's a 5-year term that the insurance company will not pay for another piece of equipment. that we do an insurance verification that's called same or similar. So that piece of equipment you really should hold on to. If it was for a loved one or someone that no longer needs it and is here with us, then you can donate it. Wonderful organizations that are out there willing to take it. Some of the thrift shops here in town. But, there's a lot of people that could really use that. We cannot take it back because we have laws and licenses that we have to provide our equipment to.
Sure. I know you can't take it back, but could they call you and then you would help them?
I would call a local thrift shop. There's a lot in our town that, there's really super ones that could really benefit and would really give it to a good home.
Right. You mentioned something else, and it's interesting about when my husband had hip replacements, knee replacements, the toilet. There are these very high toilet seats.
Right.
Which really are a godsend.
They are a godsend. And a lot of the toilets that are being installed in homes, they're a lot higher. But also you might need a raised toilet seat, or you need one with handles, or you need something that could be removable. So if you're traveling, or if you need something to soften the area, or if you need something bedside, those commodes are all out there and available, and we carry each and every one of them.
Oh, my goodness. Well, ELAINE English is the co-owner of the Boca Medical Supply with 3 stores in Boca Raton. And I'll just give you the phone number to get in touch with her. It's 561-368-7430. And then she'll tell you about the one on Glades Road. There are 2 on Glades Road. One is west and one is east. They have scooters, they have lift chairs, and they have everything in between. They specialize in post-mastectomy wear, lymphedema, garments, just all sorts of things. And she sure knows what she's talking about. So please do give her a chance. Go in there. You can go on their website, bocamedicalsupply.com. And thank you so much for being here with us.
Thank you so much for having me, Anita. It's always a pleasure to see you.